Hi parents. Yeah, I'm Dr. E again. Okay, today I would like to discuss another common question. That is, how are we going to introduce new supplements for our children with autism and what to observe? Okay, so as you know, supplements may help to support sleep, behavior, focus, gut health, and emotional regulation in children with autism. However, every child is different. Changes should be introduced slowly and carefully. So, how to start the supplement? First, start one supplement at a time. Do not start many together. Okay, so my very simple explanation to a lot of parents is that you start with supplement A for 3 days, then observe for any behavior changes, then adding in another supplement, say supplement B for another 3 days, and supplement C for another 3 days. Okay, and so on. All right. Second, start with very low dose. Begin with quarter, one fourth, or half of the dose. Increase slowly only if your child is tolerating. Okay. Bear in mind, children with autism are often more sensitive, okay, towards supplements and also changes in their system. Okay. Then third, observe daily for sleep quality, calmness, focus, learning, speech changes, digestion, and etc. So usually you can observe immediate changes or sometimes delay changes may appear in 3 to 10 days. Okay, so what are the changes? Okay, positive and negative. So positive changes that you may notice is better sleep, better mood, fewer tantrums or less tantrums, better attentions, more eye contacts, more speech attempts, and improve in bowel movement. Okay, so usually these changes are usually gradual and not sudden. Okay, however, in certain sensitive children, you may experience some temporary side effect. Okay, between first to fifth day of supplementations. First is increase in activity or excitement, because it may due to the dosage may be too high. Okay, so what you need to do is just reduce the dose. Sometimes you may experience some sleep difficulty or sleep difficulty. Okay, so the reason why is maybe the supplement timing may be wrong. So, like example, avoid B's vitamin at night. Okay, loose stool, bloated abdomen, or sometimes constipation. Okay, this is very common. For example, in probiotic, you can cause a loose stool or diarrhea. Okay, and certain supplement like vitamin B can cause constipation. That's why I always start with very low dose. Mood swing, irritability, hyperactivity, is also another very common side effect. No doubt it could be temporary. Okay, so this one indicates sensitivity towards the ingredients, sensitivity towards the preservative, sensitivity towards the content of the supplement. So reduce the dose. What you need to do, you just need to reduce the dose or stop immediately and inform your doctor. Okay, and lastly, when to stop and seek immediate advice. All right, if severe aggression, persistent poor sleep, continuous diarrhea, constipation, behavior regression, complaint by the teacher, complaint by the therapist, and as a parent, you observe the immediate severe changes in your child. You feel, believe your sixth sense. So you feel that there's something wrong, there's something not right. Okay, so stop immediately, seek advice. All right, but don't panic. Okay, I always tell the parents don't panic. Right? So, but important reminders when you're taking supplement. First, supplement support do not replace medication therapy. If your child is undertaking medications or is on certain medication, okay, supplement does not replace that. Okay, so diet, good sleep, and persistent routine are very important. Okay, during supplementation. Okay, every child respond differently. You cannot have two child, three child which are taking same supplement respond the same positive effect, same negative effect. You won't have this. because of various factors like genetic or genes variation in autistic children. Okay, and lastly, always start low, go slow. Okay, all right. So, and do reading. Do a lot of reading, but don't overwhelm with a lot of informations, whether from the support group, from the internet, or from any article. Okay, so don't get overwhelmed and go excited. Okay, start low, go slow. You're going to be safe. Okay, I hope it helps. See you in the next discussion. Bye.